Hello and welcome to the second presentation in the medical track. My name is David Sutton. I'm the Global Technical Director responsible for small animal vaccines at MSD Animal Health, and I'm hosting the medical track of our small animal vaccination symposium, Vaccination Unites Us. After an excellent opening talk, which focused on vaccination guidelines in general, we're now going to take a look at some of the specific diseases that we vaccinate against. And we're going to start with a presentation from Dr. Jane Sykes on canine leptospirosis. Before I introduce Dr. Sykes and we get started with her presentation, I've just a couple of quick housekeeping items to share with you. First, please note references for this talk will be emailed after the event. And secondly, if you experience any technical problems, please use the contact information at the bottom of the webpage. And now it's my pleasure to introduce our second speaker, Dr. Jane Sykes. Dr. Sykes is a professor of small animal medicine at the University of California, Davis School of Veterinary Medicine, with a particular interest in small animal infectious diseases. She is board certified with the American College of Veterinary Internal Medicine and is the current ACVIM president. She is one of the founders and the first president of the International Society of Companion Animal Infectious Diseases, which many of you may know by its acronym ISCAID. Her clinical and research interests currently include infectious diseases of dogs and cats with public health implications, including leptospirosis, coccidiomycosis, and antibiotic-resistant bacterial infections. Dr. Sykes, a very warm welcome to you. We'd now like to invite you to give your presentation, which is titled, Let's Talk Lepto, an update on prevalence, diagnosis, and prevention.
Hello, everybody. Welcome wherever you may be in the world. I'm really excited to be able to talk about one of my favorite infectious diseases, leptospirosis, and I want to thank MSD for giving me the opportunity to be part of these seminar talks. So leptospirosis is a globally important zoonotic spirochete disease. And recent estimates suggest that more than 1 million people a year are affected by this organism, and it accounts for more than 60,000 deaths. There's also been estimates that in the United States, leptospirosis accounts for about 0.6 hospitalizations per million people. And 70% of cases occur in tropical regions where conditions are really good for organism survival in the environment. So these numbers really don't seem very large when you compare them to, say, a disease like COVID-19. But the truth is leptospirosis is really non-specific illness. In many cases, it's a mild febrile illness that resembles influenza or other respiratory diseases. And so many cases go overlooked, and this is likely to be a gross underestimate of the total number of cases occurring worldwide. In dogs, leptospira is a significant cause of multisystemic disease with renal failure. And despite the fact that this disease is really quite preventable through vaccination, outbreaks continue to occur throughout the world in dogs because vaccination is not widely practiced. And one of the reasons why I really enjoy talking about leptospirosis is it is a quintessential One Health problem. It really involves consideration of the host, the environment, and the pathogen, and we've got to be thinking about all possible animal sources, reservoirs of this organism. So I'm going to talk a little bit about leptospira taxonomy, not too much, but there's some important changes that have occurred in recent years with quite extensive revision of the taxonomy of leptospira. There are now considered to be 64 different genus species of leptospira, and they've now been organized into two groups: the pathogens, which cause animal and human disease, and the saprophytes, which exist primarily in the environment and don't tend to cause animal and human disease. Within the pathogens, there are two groups, the P1 and the P2 group pathogens, with the P1 group pathogens being the most virulent. And the two main species that cause disease in people as well as in dogs and other animals are Leptospira enterigans and Leptospira kirchneri. But of course, there are many other species that can cause disease as well. Within these pathogens, there are hundreds of different serovars, such as icterohemorrhagiae and grippotyphosa. These names are usually familiar to veterinarians because they're present in the vaccines that we use. And those serovars are defined by their outer lipopolysaccharide antigens. And based on the relatedness of those antigens, they're grouped into related serogroups. And of course, within the serogroups, there are thousands and thousands of different strains as determined by genetic typing. One of the problems with the serogroup and serovar classification system is because it's defined by the outer lipopolysaccharide antigens, you can actually find the same serogroup in multiple different species of Leptospira. So, for example, you can find serovar grippotyphosa in Leptospira interrogans as well as in Leptospira kirchneri, two really different organisms, but with the same outer surface antigens. And so there's not just one grippotyphosa and there's not just one icterohemorrhagiae. And because of complicating and confusing factors like this as it relates to serovar classification, really there's been a move in the Leptospira world to defining organisms based on genetic typing or sequence typing. And I really love the history of infectious disease and love the opportunity to talk about it. And I think it's relevant to this seminar here because leptospirosis was first recognized by Adolf Wheel in the late 1800s. And he was a German physician that was working in Heidelberg in Germany. And at that time, he noted 4 similar cases of infective jaundice, 2 in 1870 and 2 in 1882. And he suspected, based on the similarity of the disease in these patients, that the same causative agent was likely involved. In other words, he was employing pattern recognition. And leptospirosis is truly a pattern recognition disease. Hence our success in now using a machine learning algorithm to predict leptospirosis in dogs. So this is a publication that came out of our group recently that identified a way to help clinicians diagnose leptospirosis based on the pattern of clinical abnormalities present on blood work and physical exam. Now, Adolf Wheel in 1886, he was appointed a professor of special pathology, but he resigned shortly afterwards after contracting tuberculosis of the larynx and permanently losing his voice. And ironically, shortly after receiving news in 1916 that Wheel's disease, which is the severe form of leptospirosis in people, was caused by a spirochete, when the cause was finally identified, Adolf Wheel died of acute hemoptysis. Now, the organism is shed in urine and contaminates the environment, and people and dogs become infected when the organism penetrates intact mucous membranes or abraded skin. And really, it can just be macerated skin. So if you've spent a long time in water and you get that sort of wrinkly skin appearance, that can be enough damage to the skin to allow the organism to enter. Then it rapidly multiplies in the bloodstream. This is the leptospiremic phase of illness, and it's often associated with an initial fever that then breaks. And then there's a generalized vasculitis that occurs. The organism localizes in the renal tubules and causes an acute and then subsequently the possibility of chronic kidney injury. Of course, we know that Leptospira causes liver disease in dogs and people as well, hence the icterus that occurs. but it's not a liver failure. And that's very important because it can help clinicians distinguish leptospirosis from other causes of liver disease. It's typically a cholestatic hepatic injury where you see increases in ALP, often higher than the ALT, as well as an increase in total bilirubin and sometimes cholesterol as well. But overt liver failure with high ALT and low cholesterol, low glucose, low albumin would not be consistent with leptospirosis unless something else was going on. So eventually the immune system limits the presence of the spirochetes to the renal tubular epithelial cells, and actually the organism can form biofilm on the renal tubules and then be shed in urine for variable periods of time. And typically incidental hosts that get very sick and have a strong inflammatory response to the organism may not shed organisms for very long, whereas these reservoir hosts, which are adapted to the organism, shed for longer. And so if you were to go out tonight and get leptospirosis, you could expect to get sick in about a week. The incubation period ranges from about 5 to 10 days, typically can be a little bit longer, around 14 days, and extremely rarely as long as 30 days. So we've known these associations between certain reservoir hosts and certain serovars for some time, and we've assumed these associations in particular. So rats and icterohemorrhagiae, mice and serovar bellum, the dog and canicola, and that's very important for this talk. In North America here, raccoons and skunks and Gripotyphosa, and cattle, Harjo and Pomona, and other associations have been identified as well. But the problem is given that you can find the same serovar in multiple different species, and the serovar classification is really not very discriminatory, I think more and more people are starting to instead think about associations between genotype and certain reservoir hosts rather than serovar or serogroup, because we know, for example, that you can find serovar canicola not only in dogs, but many other animal species, including rodents. But we still do need to know about these serogroups because our vaccines are serogroup specific. And so in order to design appropriate vaccines, we have to know what serogroups are circulating in sick animals in the region. So what wildlife and domestic animals are important reservoir hosts? In other words, shed organisms that potentially could infect dogs and people. And really, we don't know exactly what reservoir hosts are transmitting infection to dogs worldwide, but we do know that rodents globally are the most important reservoir hosts for human infection, and probably dogs too, in both urban and rural environments. Certainly in some situations where you've got dogs roaming on farmland, for example, cattle or sheep may be more important reservoir hosts, or if there's interaction with other wildlife species, they may be important. There was a really nice recent literature review that's on this slide here that looked at the overall prevalence of Leptospira infections in rats worldwide, and they looked at the different species of rodents. They actually concluded that 1 in 3 Norway rats are actually infected with pathogenic Leptospira strains. And so that's amazing when you think of all the rats out there in the world. Overall, 1 in 3 of them are shedding Leptospira. And of course, in certain parts of the world, that prevalence may be even higher. We also know that outbreaks of leptospirosis often follow heavy rainfall or flooding, and exposure to stagnant or slowly moving water can put people and dogs and other animals at risk of getting leptospirosis because the organism does survive in these conditions. And there's been some recent studies looking at how well Leptospira survives in the environment using modern techniques. This one study that showed that it could survive in good conditions where moisture levels are greater than 20%, more than 4 weeks in spring water, and over 16 days in moist soil. And there was another study that was done using a process called viability PCR that showed that Leptospira can actually replicate in the environment. And we didn't used to think that was the case. We used to think that pathogenic Leptospiras just kind of sat there in the environment and didn't accumulate through replication. But they can form biofilm in the environment, and they can actually grow in those conditions, especially if it's sort of muddy soil. We also used to say that freezing inactivate leptospires, and while freezing can reduce the viability of leptospires, it's possible for pathogenic leptospires to survive through freezing conditions, and they can be recultured in the laboratory after freezing. So there's been a lot of concern about leptospirosis emerging with increased flooding and rainfall, heavy rainfall in association with climate change, as well as proliferation of rodents, such as occurred during the pandemic with many homeless encampments. There's also parts of the world who have felt that it's not important to vaccinate dogs for leptospirosis because they are arid or semi-arid regions where the organism can't survive in the environment. But in fact, what we've seen is outbreaks occurring even in arid areas, probably because of direct contact between dogs or people and reservoir hosts. So you don't necessarily have to have organisms surviving in the environment for outbreaks of leptospirosis to occur. If there's crowding and direct contact with rodents or predation, as is the case with dogs, then leptospirosis can occur. And so there's been a couple of outbreaks in the United States, the one I just showed you in Arizona, and also a relatively recent outbreak that we were involved in Southern California in Los Angeles County. And this particular outbreak was investigated by the Los Angeles County Department of Public Health, and they had some nice data on their website and published a nice abstract on this at the American Public Health Association meeting. And so what happened during this outbreak is that initially dogs were recognized with leptospirosis in some doggy daycare centers in the Santa Monica area, which is a wealthy part of Los Angeles, where people were boarding their dogs in these fancy and expensive dog daycares. And so it was thought initially that dogs were getting infected in these doggy daycares. Subsequently, dogs were also recognized from other sources. So they had been to dog parks or not necessarily been at daycare or in boarding facilities. So you can see they had around 200 cases that they documented, with 156 of the dogs getting sick here and just 4 of them being subclinically infected. So the vast majority of dogs were acting as incidental hosts and getting really sick. And here's the epidemic curve. So you can see this began actually in around June of 2021. Case numbers peaked in August 2021. And then as practitioners in the area began to vaccinate, because they hadn't been vaccinating for leptospirosis, the outbreak declined and subsequently stopped by the end of 2021. Now, when they did serology on these dogs, they noted that most of the dogs were seroconverting with the highest titer to serovarcanicola, and we'll talk about diagnostic testing shortly. And because of that, a statement was made by the Public Health Department that the Leptospira serovarcanicola was the likely cause of this outbreak. And given that dogs are considered to be the primary reservoir host for serovarcanicola, this outbreak is being driven by dog-to-dog transmission. And so that interested us, and we thought, well, maybe that's true, but maybe this is not serovarcanicola, and maybe there's some other source of the infection like rodents. And that's because serology is not very good at predicting the infecting serovar. And again, as I said already, serovarcanicola doesn't necessarily only infect or reside in dogs as reservoir hosts. You can find it in other animal species as well. And so there were some other comments in the media about maybe an increase in the rodent population being an issue because of the increased homeless encampments in West Los Angeles. So that was another possible source of infection. So as I said, when incidental hosts get infected with Leptospira, they develop more severe disease and they shed organisms for short periods of time at very low intensity and intermittently. And it's actually really hard for incidental hosts to transmit the infection to other incidental hosts like people. So we'll come back to that. Reservoir hosts are much more important at transmitting infection to new hosts. So most people that get leptospirosis in developed countries get it through occupational activities like wildlife trapping and hunting, working with dairy cows, working with beef cattle, so veterinarians involved in cattle work, abattoir work, military operations that involve water, working on water-intensive crops like banana plantations, fishing, and also working in sewers. As if that wasn't bad enough, you can get lepto doing that. And then the other way people mostly get leptospirosis in developed countries is recreational activities that involve water, like fishing, hunting, wading, whitewater rafting, as well as ecotourism, and been a number of outbreaks reported as a result of ecotourism. So you can see some papers here describing outbreaks of leptospirosis among kayakers and also canoeing competitions and triathlons. The Japanese published a nice paper that described increased risk of leptospirosis in dogs that were walked along a riverbed compared with dogs that were not walked along that riverbed, increased their risk by 13-fold. And in this study, the highest titers were 2 Serovar australis. And you can see they're pretty high titers, 1 to 10,240 in a couple of dogs. And so again, they said probably Serovar australis was the causative agent here. And we don't have a vaccine that contains Serovar australis, so maybe that's needed. But again, here's a situation where the Serovar has been predicted based on serology, which is just not very reliable. So let's move on to that serologic test that's most widely used. It's called the microscopic agglutination test, or the MAT test. And so if you were to go out and get leptospirosis tonight by drinking rodent urine, in a week, you'd get sick and you would go to your doctor and they would draw blood. And then they would take the serum and make serial 2-fold dilutions of the serum in the laboratory and react each of those dilutions with a battery of live Leptospira serovars. And typically in people, they have a battery of about 30 serovars, whereas most veterinary laboratories only include 5 to 7 serovars in their panel. Because as you can imagine, this is a really cumbersome diagnostic test to do. So they react each of those dilutions with each of the live Leptospira serovars, and they look for the titer that causes 50% of the organisms to agglutinate using dark field microscopy. So you can see on this slide here in the bottom right-hand corner that there's clumps of organisms that are agglutinated by antibodies in the serum. So this is considered to be the gold standard test. But if you can imagine this dog here, a 2-year-old intact male Kelpie that's suspected to have lepto, it has serum sent to the lab and they do the microscopic agglutination test and they include just 5 serovars in their panel listed here. Early on in the course of illness, this dog has very low or negative titers because it's not been long enough for the dog to actually make antibodies. So that's one of the problems with this test, is it can be negative early in the course of illness when you're first seeing a sick dog. So then we need a convalescent titer to show seroconversion. And you can see here that this dog is seroconverted profoundly with the highest titer to Bratislava at 1 to 6,400. And the other titers represent cross reactions. They're not that the dog's been infected with multiple different serovars. But let me give you another situation now where this lab actually now has 6 different serovars in their panel and include Pomona. And you can see that now the highest titer is actually to Serovar Pomona. So you might have assumed that the dog was infected with Serovar bratislava, when in fact, there's some other Serovar involved, either Pomona. Who knows, if we put another one on there, maybe the titer could be higher again. So it's really difficult to predict using these limited panels of Serovars. Plus, there's a phenomenon called paradoxical cross-reactivity, where initially titers may be higher to a Serovar that's different to the one that's actually infecting the animal. And so this is one dog infected with Leptospira, and on day 0 goes to the hospital and has titers done, and they're very low to all Serovars because it's too early. And then on day 28, you can see this dog's titer is highest to Serovar Pomona. And then even further out, the highest titer is actually to Grippotyphosa. So it changes over time. So we really just don't know what Serovar this dog is infected with, but we do know that it has leptospirosis. So it's a diagnostic test for leptospirosis, not a Serovar identification test. Really, the only way to know what Serovars are involved is to culture the organism. And again, the Japanese did a really nice job of this in this paper, where they looked at 83 dogs with leptospirosis, and they were able to culture organisms from the urine or blood of 45 dogs. That's a lot, because lepto is really hard to grow in culture. And they were able to show that serogroup Hebdomatis was the most important serogroup present, followed by Australis. So now we know that vaccines, at least in this region, should probably contain serogroup Hebdomatis. So this just reviews those problems of the microscopic agglutination test having false negatives early, or if there's not enough Serovars included in the panel. You can see false positives with previous subclinical exposure or previous vaccination, and that's why you've got to do convalescent titers, and we usually do them 1 week to 10 days, 7 to 10 days later. The test cannot identify the infecting Serovar. There's been some efforts to use molecular testing to try to identify the infecting Serovar, but there's not good correlation between genotype and Serovar. So that's not a really good way to do it unless you've already cultured the organism, identified it, sequence typed it, and you've got that banked in a database so that then you can correlate subsequent sequence types with those Serovars. And that was done in this particular paper from Italy. All right, so because the MAT test is so cumbersome, there are some point of care tests that have now become available for detection of Leptospira antibodies, including the SNAP Lepto by IDEX Laboratories, the Witness Lepto by Zoetis, and the test at Leptospira IgM, which is a test that is made by Protivet in Belgium. Now, these assays all detect antibodies, again, to pathogenic Serovars. The SNAP Lepto is an IgG-based test, so it's going to be heavily influenced by previous exposure or vaccination, whereas the Witness Lepto is an IgM test, so it's less likely influenced by previous exposure. And there's been some studies showing that when you do get a positive result with that test, it often correlates with clinical leptospirosis. However, we need more studies using these tests in different parts of the world with where different Serovars are circulating. And when they're negative, they certainly don't rule out leptospirosis because, again, it can be too early for antibodies to form. We also have PCR-based diagnostic tests that are available for leptospirosis. And importantly, there are organisms in the blood in the first week of illness, and then organisms appear in the urine. And because as a clinician, you don't know which phase the dog is in, the leptospiremic versus the leptospiruric phase, you really need to collect both samples and submit them to the laboratory for testing. And if there's been any treatment with antibiotics that are active against Leptospira, you run the risk of getting false negative test results, and really PCR testing is not recommended in that circumstance. Because we see a lot of dogs that are referred in from practices that have already given antibiotics, often PCR is negative for us, but it can be a good test in private practice when animals are first seen. Of course, negative PCR results do not rule out leptospirosis because it's still not a very sensitive test, especially when performed on urine. And if you get a positive test result on blood, that's very suggestive of leptospirosis. But if you get a positive result on urine, you do have to be a bit careful because we know that dogs can subclinically shed pathogenic leptospires, so they can act as reservoir hosts. And so, for example, you might see a dog that has ibuprofen toxicity, and that dog comes in with renal failure, and you don't know about the ibuprofen. You do a PCR test on urine, and it's positive. But in that case, the dog's renal failure is caused by ibuprofen, not leptospirosis. The leptospira is just a red herring and an incidental finding. And there's been a few studies now shown on this slide showing the prevalence of subclinical shedding of pathogenic leptospires in dogs. And in some parts of the world, really quite high prevalence. There was this one actually done in shelter dogs in Tennessee, Virginia, and Kentucky here in the United States, where over 10% of 200 dogs in the shelter were shedding organisms. And so the other diagnostic test that's out there is culture. And we've always put culture on the back burner because it is so difficult. But there are some innovations in leptospira media that have occurred recently that have allowed us to culture organisms more readily. And so this was actually a sample from a dog in the Los Angeles outbreak where we were trying to identify what serovar was present. And so we sent some samples to the USDA, and they cultured the urine. And within 24 hours, they were sending us videos of these spirochetes swirling around inside the media. So that was really rapid, similar to what you would get for any other bacteria. And they were able to type this, and the organism was indeed Serovar canicola. But it doesn't mean that dogs were necessarily the reservoir host that were transmitting it to other dogs. Now, there's been a situation in California sea lions where they've shown that sea lions can have chronic shedding of a particular strain of Serovar pomona and be unaffected clinically. But then the juvenile sea lions, when they get immunosuppressed and infected, get outbreaks of disease by the same organism. So it's possible that stress because of overcrowding in those boarding kennels could have led dogs to develop disease, or it may be that there was really some other source of that Serovar canicola, like a rodent. So in practice, you need to have a good understanding of the pattern of clinical abnormalities that leptospirosis is associated with so that you don't miss cases, because most of the diagnostic tests that we have are retrospective. So the pattern of clinical abnormalities that you might see in a dog with leptospirosis is shown on this slide, and you may see one or more of these abnormalities in combination. Most dogs with leptospirosis are going to have evidence of renal failure. And there are some reports of dogs with only liver involvement and no evidence of renal failure, but that's relatively rare. You may see a fever initially that then breaks, and you may also see evidence of reluctance to move because of the myositis that occurs with this disease. Many dogs have evidence of abdominal pain due to kidney pain or pancreatitis. You often see a mild generalized lymphadenomegaly. You can see respiratory complications due to pulmonary hemorrhage, which I'll talk about. And then common blood work findings include a neutrophilic leukocytosis, mild to moderate thrombocytopenia, a normal potassium despite oliguric or anuric renal failure because the organism interferes with the sodium potassium ATPase. You can see high CK, and oftentimes you see glucose in the urine in the absence of hyperglycemia. And that's why this machine learning algorithm can be so useful to help clinicians recognize the disease early because of these characteristic patterns of abnormalities. Dogs with leptospirosis can have other manifestations other than kidney and liver problems. Pancreatitis, I mentioned, and these images here are from a dog that had leptospiral pancreatitis and a really large hyperechoic and hypoechoic pancreas. Oftentimes we see myositis, as I mentioned, uveitis in about 10% of cases, and you can see leptospiral pulmonary hemorrhage syndrome causing respiratory difficulty. This dog here in this picture was a dog that had leptospirosis in the Los Angeles outbreak, and you can see necrosis of the dog's tongue, and there were several dogs that had necrotic lesions in this outbreak. And these are all dogs with pulmonary hemorrhage syndrome. So you can see diffuse mixed patterns, including alveolar patterns and nodular interstitial patterns. And sometimes this can be mild, but sometimes it can be very severe and require mechanical ventilation. This was the youngest dog that we saw recently with leptospirosis, Boomer, a 3-month-old intact female German Shepherd dog mix, really cute little puppy. And she actually needed dialysis, and her total bill was nearly $20,000 at just 3 months of age. So this is really the youngest age that we can even start vaccinating dogs as well. So that does bring us to vaccines, and current vaccines are whole bacterians. And as I've talked repeatedly during this presentation, they are serogroup specific vaccines. And 4 serovar vaccines are really now recommended, at least we recommend them for all dogs, because any dog is at risk of lepto, including urban backyard dogs. And now we're really seeing dogs with leptospirosis that are unvaccinated, small breed dogs. And so, you know, the at-risk dog is an unvaccinated dog as far as we're concerned. So there's been a number of publications recently that have supported reduction in disease when vaccines were changed from 2 serovar to 4 serovar vaccines. And currently the British Small Animal Veterinary Association recommends them as core vaccines, and WSAVA and AHA are still recommending them as non-core vaccines. The vaccines do still have a 12-month duration of immunity, and they've really been improved in terms of their adverse effect profile. The vaccines have all been cleaned up, so the reaction rates are really quite similar to those seen with DHP vaccines. So we recommend them even for small breed dogs. And so these are the publications that have been published recently describing reduction in disease in association with vaccination. In terms of treatment, just briefly, treatment of choice is doxycycline, and you can give it early if a dog is not vomiting, and just 2 weeks of treatment is needed. If a dog's vomiting or nauseous, then we give IV ampicillin initially. In people, they use IV third-generation cephalosporins because they can be given just once a day, but that's probably not optimal antimicrobial stewardship. And so if dogs are not making urine despite aggressive fluid therapy, really they need dialysis. And so access to dialysis and the cost of dialysis is a huge problem. It's much easier and better to prevent the disease through vaccination. We don't isolate dogs with leptospirosis because they need intensive care generally. So we just recommend transmission precautions. And so early antibiotic therapy is the most important thing. And then we post signage, wear gloves and gowns, minimal handling by different individuals. And we certainly don't allow pregnant women to handle suspect cases. Use any disinfectant because leptospira is pretty easy to destroy with any disinfectant. And after 48 hours of antibiotics, we remove the precautions. And there's been a few studies published also showing that despite outbreaks of leptospirosis and despite extensive exposure to organisms in urine, there's been no evidence of human infection. So one done in Arizona outbreak by the CDC and another one done here in Europe showing no evidence, no serologic evidence of infection in people that were closely associated with leptospirosis cases. And that's probably because dogs are acting as incidental hosts, as I said, and they don't shed very many organisms in their urine. But it's still a good idea to take precautions. And I wanted to finish with this really interesting study that's just been published, which modeled leptospirosis in people, humans, and free-roaming dogs. And though they showed that dogs weren't a likely source of infection for humans, that rodents were more important, were predicted to be more important. If dogs were vaccinated, you could also reduce the prevalence of infection in rodents. And so rodents were less likely to be a source of infection for people. So super one healthy, but shows that, you can have these cycles of transmission among multiple different host species, and that vaccinating dogs, even if dogs are not the main source of human infection, can actually result in reduced human disease, at least as modeled in this study. So I want to thank you very much for your time listening to this seminar. I hope you enjoyed it. I'd be happy to take any questions, and I'm going to pass it over to the moderator. Thank you.
Thank you, Dr. Sykes, for this excellent and informative update on this important zoonotic disease. I can see that we do have a few questions for you. The first question is regarding dog breeders. How can we convince them that leptospirosis vaccination is safe?
My answer to this question is that it's really important to provide information to breeders about leptospirosis as a problem and talk to them about outbreaks of disease that's occurred in small breed dogs, including small breed dogs. And interestingly, in the Los Angeles outbreak, it was actually dog owners that were convincing veterinarians to vaccinate their dogs. They'd heard about the outbreaks in the media and were asking their vets to vaccinate their dogs. So stories like that, I think, can be convincing for breeders, and also letting them know that the new vaccines are very different to the old vaccines, and they are similar in terms of their adverse reaction profile to the other core vaccines like distemper and parvo. And so usually these breeders are happy to have vaccines for distemper, hepatitis, and parvo. And so if you can convince them that reaction rate is similar with the new lepto vaccines, and that there have been outbreaks in their dog breed, then I think you can get them on board. And if you don't have time to talk to them, then I recommend providing them with a pamphlet on the disease and educational materials that they can take home with them.
Thank you for that important information. We've got another common question around vaccination. If dogs lapse on their annual vaccination, do they then require a booster vaccination?
Yeah, so this is another common question. And I think really what the question is asking is, if they go over 1 year, do you have to give an initial and a subsequent booster vaccination? In other words, restart the series, as opposed to just giving one vaccine. And so really, it depends a little bit on the manufacturer's guarantee, and we don't have a lot of evidence on this one. And in human medicine, even with bacterians, they would generally consider that one vaccine would be enough, even if a person was really overdue, even years overdue on vaccination. However, what is currently being recommended for lepto in dogs is if it's 15 months or longer after the previous vaccination, to actually give an initial and a booster vaccine 3 to 4 weeks later. And certainly there are some manufacturers that if you want a manufacturer's guarantee, if that dog subsequently develops leptospirosis, then the expectation would be that you had reboosted after a lapse. And the 15 months just comes from the fact that there's been duration of immunity studies now showing protection out to 15 months.
That's a great response. Many thanks for that. Now, switching gears over to our feline patients, one question is whether cats can get leptospirosis.
Yeah, so there's been a lot of new literature about cats and leptospirosis. It's actually quite fascinating in sort of two different scenarios. Firstly, cats as incidental hosts, which this question is asking about, and also about cats as reservoir hosts, especially given that they are often, outdoors preying on rodents, which might be infecting them. So leptospirosis certainly can occur in cats, and there's been a handful of reports in the literature of usually individual case reports of cats with lepto, and they look very similar in terms of the pattern of clinical abnormalities to dogs with lepto. So when you see them, they've got azotemia, and they can have hepatic involvement and thrombocytopenia, neutrophilia, but they do seem to be quite resistant to lepto because we don't recognize a lot of leptospirosis in cats like we do in dogs. So there's really just very rare case reports. So certainly not enough to be recommending that cats be vaccinated. Looking at cats as reservoir hosts, the studies are pretty variable worldwide. Depends really on geographic region. There's been some studies, such as one study in Australia, showing that as many as 45% of feral cats were infected with pathogenic leptospires by doing PCR on their urinary tissues. Whereas we've just finished a study here in Northern California looking at feral cats in Northern California and in Texas, and we were unable to find evidence of leptospira DNA in the urine of those cats, but 10% of them were antibody positive. So there was evidence of exposure in 1 in 10 cats, but no evidence of an infection. And of course, you might need to look at kidney tissue because not all cats would be shedding organisms in their urine to find spirochetes. Using PCR, we were unable to do that. But again, if you look at other studies across the world, there's sort of that similar variability. Some studies showing not very much evidence of infection, even in feral free-roaming cats, and others showing quite high prevalence rates, such as in more humid tropical type regions.
Many thanks, Dr. Sykes, for your excellent answers to these questions, which definitely help fill in some more detail about this fascinating disease. Unfortunately, I can see we're now almost out of time for this session, and so unable to take any further questions for now, and we'll need to move on to talk about some of the other vaccine-preventable diseases in the next sessions. A quick reminder for our audience, your participation certificate for this talk will be emailed to you after the event. And we look forward to seeing you at the next talk. So with that, I'd like to once again thank Dr. Sykes for giving us such a globally relevant and up-to-date overview on canine leptospirosis.